But what we know here is that the FDA is, some would say, 50 to 60% funded by these pharmaceutical companies. A lot of these patients, they might be 20, 30, 40 pounds away from being a good candidate. So these peptides, GLP-1 agonists as they're called, they're really just a tool.
Take me through exactly what the Mommy Makeover will do and what your thoughts are on the Mommy Makeover procedure. Today I have Dr. William Bruno, a top plastic surgeon in West Hollywood. We are going to tell you everything you need to know about longevity, wellness, anti-aging in conjunction with plastic surgery. Welcome back to my channel. I'm Joanna Palante. I'm a mom and entrepreneur, and I have a passion for holistic living. I wanted to bring Dr. Bruno on because not only are you a top plastic surgeon who specializes in anything from mommy makeovers to liposuctions to breast surgeries, just to name a few, but you are really passionate about helping people from the inside out. And we live in the same building. I see you. You're a true testament to health and wellness. So not only are you very careful about what you eat and passionate about your diet, but you're also in the gym every day and just really an inspiration as far as being a doctor who is committed to helping people just be the best version of themselves. So on that note, I know that a lot of people these days are concerned with what's going on in America. We have an obesity crisis. We have this Make America Healthy Again movement, which is gaining traction, which I love. And I think that a hot button topic right now is Ozempic. I have never tried Ozempic. I truly don't know much about it myself. I know that your office is able to administer some kind of alternative form of Ozempic. So maybe you can just walk us through what you're seeing as far as patients who come in and consult with you on this and what you are prescribing for them.
Yeah, I see a lot of patients mainly coming in for, procedures like tummy tucks, liposuction, breast augmentation, breast lifts and the like. And some patients just aren't great candidates at first, largely due to their weight. They might be overweight, they might be obese. We go by BMI, body mass index, and we sort of stratify them. So a lot of these patients, they might be 20, 30, 40 pounds away from being a good candidate. So we would offer Ozempic to someone like that in certain cases. So we do prescribe a compounded version of Ozempic, which is semaglutide, as well as Mounjaro, which is tirzepatide. And these are made at compounding pharmacies sort of all across the country because there's an FDA shortage on name brand Ozempic, Wegovy, Mounjaro. So we're allowed to do that. And I think it's helpful, but these peptides, GLP-1 agonists as they're called, they're really just a tool. And that's all it is. It can help people lose weight. Ideally, patients would lose weight through lifestyle modifications, diet, exercise, so on. I think in some cases when that has failed them and they need help, I think it's a great tool. However, people wonder, am I going to be on this drug forever? How long do I have to be on it? Do I stay on the drug for 6 months or a year? Then do I get off of it? One of the things about this class of drugs is that it was sort of pushed through relatively quickly as far as getting approval, FDA approval. The study was only about 68 weeks, which is like a year and maybe 3 or 4 months. And it got approved for type 2 diabetes primarily, and now for weight loss. So, we don't know what happens if you're on the drug for 5, 10, 20 years. So that's a consideration. But if you look at it from another standpoint, what we do know is if someone is obese, we do know what's going to happen to them. We do know they'll have shorter lives, they'll have heart attacks, increased risk of heart attacks, increased risk of type 2 diabetes, etc. The long-term risks of Ozempic are sort of unknown, but that's sort of where we stand now. And again, I think it's just a tool. It has to be done in conjunction with lifestyle if you want to be successful on these drugs, primarily eating a higher protein diet, doing some form of resistance training, because about 20 to maybe 40% of the weight loss is muscle loss, which you don't want, because then if you come off the drug and you gain half the weight back, which a lot of patients do, you're gaining back fat. You're not going to gain muscle back. So now you're sort of further in the hole, so to speak, from a body composition standpoint.
So you would say about half of your patients do, if they don't follow your sort of care plan, they're going to see that weight come right back on if they're not careful about the lifestyle changes that you're talking about.
Yeah, if they don't make lifestyle changes and they abruptly come off, or even if they sort of get tapered off the dose, they will gain some weight back. How much is really up to them. Like hopefully they have made those changes and they've changed their diet and they're at least moving more, walking more, exercising. But Yeah, it's a short-acting peptide or a short-acting drug. It lasts maybe 5 days in the system and it's gone. People are taking this injection once a week, and then the dose incrementally goes up. So after a certain number of months, you're at the maximum dose. But there are ways to wean people off of the drug, and it can be done successfully without losing muscle. But most people, they aren't getting that guidance, or they're not doing it through a doctor's office. I mean, so many people have access to the drug. They're getting it online for very low prices. Name brand Ozempic is about $1,500 a month. You can get it compounded, like our version is more like $500 or $600 a month, but some people can get it for $200 a month. And they're having no follow-up. They're not getting any labs before and not getting any blood work checked after. So it's sort of, it's widely available now, but it's not widely monitored, I guess I'd say.
I saw a video recently, RFK actually posted it on his Instagram about how it's banned in Europe, and that's, I guess, where it was developed. Again, I'm not super familiar with this, but I thought to myself, like, red flag, it's banned somewhere where I believe it was Denmark. I mean, we can, reference the video, but I just thought it was interesting that it's so widely, like you said, just people can't get enough of it here in America, but obviously in other places, they're not falling into this problem that we're having here.
Yeah, the manufacturer of Mounjaro, the manufacturer is in Denmark, and it actually has become like the number one selling, product probably in the world, or that's becoming the most profitable company, I would say, in Europe. And I know the cost there is about 1/10 of the cost it is in the United States. Is it going to be banned? I don't know. I don't know how the FDA, their equivalent of the FDA, sort of works over there. But what we know here is that, the FDA is, some would say 50 to 60% funded by these pharmaceutical companies. So, they can get approval of them rather quickly. I'm not sure how it works in other parts of Europe, but I know the drug still, as of the time of this recording, is still wildly popular in Europe. And available in Europe. Yeah.
Going back to how we mentioned you would basically have a patient look into one of these, peptides or different variations of Ozempic, Mounjaro, before doing a surgery, right? So the typical person who's coming to you for a liposuction, what would you say is, they're struggling with the most? Is it like a common thing where they've tried to lose the weight by doing it on their own, whether it's diet or, or are they just coming to you because they just see it as like this quick fix kind of thing, and they just want to, look their best and not really put in the work?
Yeah, I think there are some patients who do believe that liposuction, for example, is a weight loss tool, which it isn't. Liposuction is great for contouring and reshaping. Weight loss, not so much. Even on a very heavy patient, let's say if you did liposuction, maybe they could lose 6, 7, 8 pounds, and that's a lot. That's a bit of a large patient. But that's not the goal of it. And there are certain rules in the plastic surgery world that we sort of abide by, like how many liters we take off someone. So we don't go so much by weight, but volume. So if someone comes in and they're looking for weight loss, they're not a candidate, quite honestly. And we recommend either, lifestyle changes. The Ozempic, again, it's a tool. Some people come to me and they're already on it, and they're already losing weight in preparation for surgery, or they've been on it for a year and they're getting it through their primary care doctor. But, most people, I think they perceive, getting a tummy tuck as a way to lose weight. I think that's not the goal, really. I think most women, they're moms, they've had a few kids, they have loose skin, and they're, they want to have a tummy tuck. But if their BMI is too high, then we sort of advise them, because it's generally, it's not safe to do any kind of plastic surgery on someone who's, let's say, obese or has a relatively high BMI, which we would categorize as someone over 30 or 32 as a BMI.
The BMI number would be over 30, 32, where you start to question.
Yeah, and the BMI for the listeners there, body mass index, it sort of takes into account height and weight in proportion. Now, it's not super accurate. It's a screening tool. Like football players, they're very muscular and tall. They have really high BMIs. I'm talking about normal people, normal American person who, someone's like 5'5", and they're 180. That's not safe to put them to sleep necessarily, to go through a 2 or 3 hour surgery. So yeah, I think that's where the drugs like Ozempic and Mounjaro can come in to get them through a surgery, but not even so much for the surgery, to lower the risk of all the chronic diseases like the type 2 diabetes and some cancers and even dementia and cardiovascular disease. So I do think there's a role for Ozempic. It's just, it shouldn't be abused. And I think some people do. They come in and say, hey, I want to lose 15 pounds. Well, it's not necessarily for those patients, but people are using it that way. I don't recommend it, but that's what's happening.
That's what you're seeing.
Yeah.
So I'm still probably not that familiar with exactly what a mommy makeover consists of. And I know that that's one of your areas of expertise. So can you take me through exactly what the mommy makeover will do and, what your thoughts are on the mommy makeover procedure?
Yeah, a mommy makeover is sort of a broad term describing, procedures that's going to restore a woman back to their pre-pregnancy form. It's usually consisting of a breast procedure combined with an abdominal procedure. So the breast procedure could be breast implants and a breast lift, or maybe just a breast reduction. And the abdominal procedure is usually a tummy tuck, where we're fixing their abdominal muscles, restoring the abdominal wall back to its pre-pregnancy state, plus minus maybe some liposuction. So that's a sort of a general category. In mommy makeover, it's usually the best done when someone is, coming into the surgery at an ideal weight. They've had all the children they plan to have, and they're sort of ready to, remove any loose skin or improve the shape of their breasts and their abdomen. And if they come to me and they do need to lose weight and it's not at a safe weight, then we talk about lifestyle first. I think the GLP-1 agonists, the Ozempics, are sort of a backup to that.
And what's the downtime from a surgery like a mommy makeover?
Typically patients will take about a week off from office work, and they'll take about 4 to 6 weeks off as far as exercise activity. After 6 weeks, most people can resume, weight training, working out a little bit more strenuously. But for those first 4 to 6 weeks, most people are just walking.
Well, I hope you learned as much today as I did. I feel like I'm going to implement so many things that Dr. Bruno shared here today. We are going to link his longevity program. So if you'd like to sign up, I'll offer a discount code. You can really get into some personalized programs with Dr. Bruno. I'm also going to link my guide to how I personally lost 50 pounds after pregnancy, and we'll share links to many of the products that we reference in the videos as well. Thanks for coming by.